Right now, we want to turn to a big study that's out just today looking at immunity to COVID-19. New York State was part of this research that involved more than 32 million American adults. The study looked at 4 distinct groups of people: those who are unvaccinated with no previous confirmed case of COVID, vaccinated people with no previous infection, unvaccinated people with a previous COVID infection, and then vaccinated people with a previous infection. So the study found that the vaccines were way more effective prior to the Delta variant hitting. All along, the most at-risk group was obviously those who were unvaccinated and without any natural immunity. And this is what we can look at specifically with New Yorkers. This was in October when Delta was hitting hard. Just getting a vaccine made you more than 4 times less likely to get infected. Just having a previous case of COVID but being unvaccinated made you almost 15 times less likely to catch the virus. And then having both, so natural immunity and getting the vaccine, made you a whopping 20 times less likely to catch the virus. Now, to be clear, that's just looking at infections, not hospitalizations. We know that the vaccines are still very good at preventing severe disease. And while this data was from October, if you look at before Delta, maybe back in May, the vaccine actually provided better protection than natural immunity. But it really shows how vaccine protection has kind of waned over time. That's why people have been pushing boosters so much. To help us kind of understand this, we asked Dr. Sellick with Kaleida Health and UB's medical school to get his thoughts and kind of the biggest takeaways from this new research today.
Initially, when we were talking the so-called ancestral variant and then the alpha variant, vaccine worked very well. And then once we got into the summertime, which is when Delta predominated, then all of a sudden, maybe the people who had gotten vaccinated 6 or 8 months sooner, their immunity is starting to wane. And people who got Delta and survived then got a good boost of their immunity from having that infection. So I think biologically it kind of makes sense.
We also asked Dr. Sellick if previously infected people showed a stronger immunity against the Delta variant, if that could mean that they're safe to be around crowds like in sporting events or concerts without being vaccinated. He says it's too tough to tell the level of immunities that people have because it can really vary so much from person to person.
Again, it's probably going to depend on which variant they have. If you got infected with Delta and you had a significant infection, you're probably going to come out of it with good immunity. If you had a mild infection, especially with Alpha, or what we're seeing now with Omicron, it may not give you immunity that lasts that long. Plus, we don't know how that immunity is going to work against other variants.
Dr. Sellick says he hopes that this study will continue to try to research immunity from the Omicron variant, but his message remains the same, that everyone, no matter if you've previously been infected or not, you should get vaccinated and when eligible, get a booster.